it tests the genetic profile of the embryo before the embryo is being implanted into the mother's uterus, thereby increasing the chances of having a healthy baby.
PGT is indicated in advanced maternal age who are at risk for increased miscarriage and high prevalence of aneuploidy of oocytes and embryos, couples with recurrent pregnancy losses, couple with recurrent implantation failure, male partner with severe male factor infertility, if one or both the parents carry a known chromosomal abnormality or carry the genes for single gene disorders. It is also indicated in couples who have a child or a family member with a serious genetic condition.
To do pre-implantation genetic testing, the couples have to undergo a cycle of IVF or in vitro fertilization, in which the women, it will start on the day 2 or day 3 of the periods. It will start with scans, and it will start with daily injections for a period of about 10 days, and serial scans will be done to monitor the growth of the follicles or egg. And once they are all ready, transvaginal aspiration of the eggs will be done. Egg retrieval will be done under sedation, and the eggs will be inseminated with the husband's sperm to form embryos, and the embryos will be cultured in the lab for a period of about 5 days till it forms the stage called blastocyst. And once blastocyst expands, few cells from the outer layer of the blastocyst called the trophectoderm cells are removed by biopsy and sent in the media for testing to the lab. Once the biopsied embryo cells reach the lab, the scientist will run the tests on the embryo, which is by a technique called next generation sequencing. And once they test the embryo cells, they report it as either euploid or aneuploid. See, what they see in this testing is the number and structure of chromosomes. If the number and structure of chromosomes of the embryo cells are normal, then they call the embryo as euploid. If the number and structure of the chromosomes of the embryo are abnormal, the embryo is called aneuploid. And aneuploid embryo will not implant, and it will result in a negative pregnancy test, or it will result in miscarriage. Euploid embryos have higher chances of implanting, and euploid embryos results in a positive pregnancy test or increases the success of an IVF program. So we select the euploid embryos by this testing, and we implant it in the uterus so that pregnancy happens, and we discard those aneuploid embryos after getting consent from the couple. And the couple will undergo a genetic counseling prior to undergoing this pre-implantation genetic testing to understand how the procedure is done and their risks, benefits, and then they give a consent to undergo the test before it is done. Pre-implantation genetic testing comes under the Preconception and Prenatal Diagnostic Testing Act of India, which prohibits sex selection. So, sex chromosomes are not revealed in this test.
PGT is used to identify the numerical chromosomal abnormalities such as monosomies, trisomies, structural chromosomal abnormalities such as deletions, inversions, translocation, insertion, and single gene disorders including autosomal dominant disorders, recessive disorders, or X-linked disorders. It is also used to identify hereditary cancer syndromes such as hereditary breast and ovarian cancers. It is also used to identify the HLA compatible unaffected embryos, allowing the affected family members to receive the compatible bone marrow transplant or cord blood transfusion.
To put it in a very general manner, there are two types of PGT. PGS is done in couples who are genetically normal, and PGD is done in couples who have genetic issues in the family or who have karyotype having chromosomal translocations. By doing PGD, we prevent the genetic diseases from transmitting from the parents to the children, thereby ensuring a healthy child is born.
Abnormal or aneuploid embryos lead to implantation failure and miscarriages, thus resulting in unsuccessful IVF. Transferring chromosomally normal or euploid embryos increases the chances of conception, that is pregnancy rate. It also reduces the abortion rate and time to pregnancy in IVF cycles.
So the success rate of any IVF program depends on the age of the mother. So as age increases, fertility reduces. In women less than 35 years, the success rates of an IVF program will be around 50 to 55%. When they reach between 36 to 38 years, it falls to 40-45%. Above 38 till 40 years, it's about 30-35%. And above 40, it's about 20%. And above 42, it's less than 10%. So by doing preimplantation genetic testing in women more than 38 years, you select the embryo which is euploid, which you select the embryo without chromosomal problem, so that it increases the success rate of older women to that of an younger woman. So if a woman more than 38 years undergo PGT testing and transfer her embryos, her success rate will be that of a woman who's less than 35 years.
There is minimal risk to the mother due to the IVF procedure. The biopsy process, which involves removal of few cells from the embryo for the genetic testing, can also cause small damage to the embryos. Even during the process of freezing or like thawing, the embryo can undergo damage, but in experienced hand and with proper techniques, the risk is very low or negligible.
Preimplantation genetic screening is offered to women more than 38 years of age to improve the success rate. Also, it can be done in less than 35 years of age. Also, PGT can be done if they have multiple IVF failures, if they have recurrent implantation failures, if they have repeated abortions, more than 2 or 3 abortions, or if the men has severe male factor infertility, less than 5 million count, they can opt for PGS even if they are younger in age. And also in women who have genetic diseases in the family, and in women who have HLA incompatibility, such kind of patients, even when they are younger in age, they can opt for PGT.
After the embryo biopsy, if the results are received in 24 hours, the embryo transfer is done in the same cycle. If it takes 1 to 2 weeks time to report, the embryos are frozen, and later in a frozen embryo transfer cycle, euploid embryos are thawed and transferred into mother's uterus.
It depends on the cost, depends on the patient profile, how many cycles they require to form the embryos, the number of embryos they are sending for the testing, and depends on which lab they are sending. And also it depends on if they have a genetic disorder in the family, if they have to make a probe for that genetic for that single gene, then it depends on how much cost it takes to make the probe and how many embryos they are going to test, and are they doing PGS and PGD together. If they do it together, it might be a little expensive for them. So it entirely depends on the patient profile and their need.